Welcome to Vetcare. Today, we are going to discuss rabies. A fatal, progressive viral encephalomyelitis caused by lyssaviruses. It is a zoonotic disease, meaning it can spread from animals to humans, and it affects all mammals, especially dogs, bats, and wild carnivores. Understanding this disease is crucial for anyone working with animals. The causative virus belongs to the lyssavirus genus in the family Rabies. Its genome is single-stranded, negative-sense RNA. After entry, the virus first replicates at the inoculation site, usually in non-nervous tissue. After that it travels via peripheral nerves to the spinal cord and brain. From the brain, it spreads to the salivary glands, which is why it is shed in saliva and transmitted through bites. Rabies is highly neurotropic, eventually affecting nearly all innervated organs. Epidemiologically, rabies is maintained in reservoir populations such as dogs, foxes, raccoons, skunks, bats, mongooses, and jackals. Transmission occurs mainly through bites or saliva contacting fresh wounds or mucous membranes. It is not transmitted through casual contact, or blood. Aerosol transmission is extremely rare, mainly in laboratories or crowded bat caves. Rabies is found worldwide except Antarctica, though strict vaccination and quarantine measures have controlled it in some countries. The incubation period varies depending on the site of infection and viral dose. In dogs, it typically ranges from 21 to 80 days, but in rare cases, it can last years. Clinically, rabies show three phases. First is prodromal phase begins with subtle behavioral changes such as anorexia, irritability, and hiding. This is followed by the excitative or furious phase, characterized by aggression, hyperactivity, roaming, and biting, often referred to as mad dog syndrome. Finally, the paralytic phase sets in, marked by ataxia, paralysis of the throat and jaw, drooling, inability to swallow, leading to coma and death. Species show variations in signs. Dogs and cats often show aggression and salivation. Cattle may become furious, stop lactating, or bellow abnormally. Horses become restless and may bite or roll. And wild animals may lose fear of humans and display unusual daytime activity. Diagnosis of rabies is challenging because no definitive antemortem test exists. Postmortem, the brain, is examined. Immunofluorescence microscopy is the preferred method due to its speed and specificity. Molecular tests like PCR or virus isolation can be used, though less commonly. Clinical signs alone are not sufficient for diagnosis. Prevention is the most effective approach. Vaccination of animals is essential. The recommended schedule includes: in dogs and cats. First dose, 12 to 16 weeks of age. Booster, 1 year later. Then, every 1 to 3 years, depending on vaccine and regulations. In livestock such as cattle, horses, sheep, goats. First dose, 3 to 6 months of age. Booster, annually, or as risk-based. Domestic animals exposed to rabies are managed depending on vaccination status. Unvaccinated animals may be euthanized or quarantined for 4 to 6 months, while vaccinated animals are revaccinated and observed for 45 days. Managing stray populations through vaccination or euthanasia are important strategies. The virus is labile and can be destroyed with heat, UV light, formalin, and alcohol. Post-exposure management in humans is crucial. Healthy, unvaccinated individuals require wound care, rabies immune globulin, and a vaccine series on days 0, 3, 7, and 14. High-risk groups like veterinarians, lab workers, and animal control personnel should receive pre-exposure vaccination. In conclusion, rabies is a fatal but preventable disease. Early recognition, timely vaccination, strict biosecurity, and responsible animal management are the keys to protecting both animals and humans. By understanding the virus, its pathogenesis, and proper control measures, we can ensure safety and effective prevention. Always remember, rabies is 100% fatal once clinical signs appear, but entirely preventable with the right measures. Thanks for watching Vetcare. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.